Alright, SOT breakdown. SOT is all about CSF. When you have a subluxation, you create CSF stagnation through dural or meningeal tension. CSF brings nutrition to the spinal cord, brain, nerves, removes waste, and it's the most electrically conductive liquid in the body. So when you have that stagnation, you're not getting proper nutrition, waste is building up, and it's not conductive. It's like having a low battery, trying to get that car started. So the adjustment jump starts it, gets everything flowing. There are two CSF pumps in the body. One's up here, occiput upper cervical. One's down here, sacral. Dura attaches here and here. So the major subluxation of a patient in SOT will always be here or here, and all subluxations in between will be compensatory. So we got to address the cause. Category 1 is the first phase of subluxation SOT. It's just a simple dural tension, primary respiratory mechanism problem. We'll go over that. Category 2 is the SI weight-bearing subluxation. That's the next phase. Your SI joints is where all the weight-bearing forces of your body get dispersed. They come down from your head and up from your feet and get dispersed in your SI joints. So they're very important parts of your body. Category 3 is now a disc issue. Pretty straightforward. So what we want to do to quickly categorize a patient and get them on the blocks properly is what's called mind language. So you're going to brace the shoulder, bring the arm up.
That's another insufficiency.
You want to find out if they have any shoulder issues. I mean, most people won't. So you're going to do a normal test just to test their strength.
Like it should just be.
So I just say, I'm going to push down, resist, resist. Okay. Now we're going to start with category 3. Bend forward at the waist for me. We're activating that area. Bend back up. I'm going to press down, resist. Okay, strong. Then we're going to activate the SI joints to see if there's a problem there. Stand on just your right leg for me. And both. I'm going to press down, resist. Okay, stand on just your left leg for me. And both. And resist. A little weaker there. It won't always be a complete failure. You're looking for just some sponginess most of the time. And then category 1, the respiratory mechanism. Take a deep breath in and hold. And we'll check. Take a full exhale out and hold. And we're good. So we're going with category 2. It's a quick way. You activate the body, testing the biomechanical, circuitry area. If the body senses a problem there, the attention goes there, and it forgets about the arm bang. Muscle fails. So we'll start with category 3. And we'll work our way down just to show you how to place the blocks properly. So for category 3, I would have Anya go face down, and I would find out the long leg and the short leg. She's got a long left and a short right. So the left would be an AS ilium, and the right would be a PI ilium, SOT, and I would place the blocks like that. The top block will be coming down right at the ASIS. And the bottom block will be coming down just at the head of the femur, and you're going to put it down like that. And for category 3, you can let her sit there and cook. 10 minutes, 15 minutes, just we're going to let you relax, take some nice deep breaths for me, and I'm going to go take care of some other patients. I'll be right back, and you can leave her there for 10 minutes, let the body just release some of that tension. Another nice move, once you have the blocks in place, is you can do a step out, toe out. You find which area is most tense, and you just bring the leg out, twist the toe out, and get in on that piriformis, and just press. It'll help relieve some of that tension in there. Just hold it, and good. Okay, so that's category 3. That's if they fail when you bend them forward, bend them back up, and bring them down. What you can also do in category 3, since they're there so long, is you can adjust the thoracics, the cervicals, while they're on the blocks. Just don't thrust into the blocks. So, say she was category 2, and then her arm, mind language failed when she stood on one of the legs, SI weight-bearing subluxation. So I'd have her flip over for me, please. Once again, address the legs. she had a long left. So I would come here again at the ASIS, put the block in like this, come down again to the head of the femur or the ischial 2, and bring it like that. No, it's alright. So, and then you just, category 2, you don't want to leave them on there very long. 2 minutes or less. Once they're on it, it would be like that, obviously. She was a category 2, so we could actually put her on this. So it would be like that. And like that. You technically want to have them bring their leg up and push off so they lower their body onto the blocks. But you can do it this way too and you'll get results. So here, just apply a little pressure, help the body make that adjustment. You can explain to the patients, because most of them think nothing's going on, that it's a low force over a longer period of time making the subluxation, making the adjustment. So low force, longer period of time, and it is actually incredibly powerful. And with gravity and breathing, the body makes the adjustment. You're just applying the leverage or the push to jumpstart it. So 2 minutes or less, and they're done. You can pull them out.
Then how do you determine when they've made the correction?
You can
when
do
to take
test,
the blocks out.
While they're on the blocks, you just get on the inguinal ligament and you test. There's a bunch of proprioceptors in this area, and once the arm goes strong, the body's made the subluxation. So if it's slower on one, but it's a tough test to tell. You have to have a lot of skill. So in the beginning, if you just get them on the blocks for 45 seconds to 2 minutes, you're moving them in the right direction. As your skill and feel increase, you can start to feel when that arm's gone strong. And then last, where you want to get everyone, is category 1. Flip over for me. And short right, long left again. So we're coming in on the ASIS and the head of the femur. Boom. In category 1, you can let them cook as well. You can go take care of a few other patients and come back, adjust the thoracics, cervicals, and move from there. So that's the basics of SOT. Sorting that pelvis out, reducing that meningeal dural tension, allowing that CSF to flow, which is going to bring nutrition, remove waste, increase the conductivity, and your whole body will function better. I mean, when that CSF stagnates, the nerve gets diseased. What happens to an organ that has a diseased nerve? Well, the organ's going to get diseased. That's how it works. So you explain that to the patient so they know what's going on, and you go from there.
Good.
Where do you go?